I have been touring rural Lagos alongside the Women Advocacy Research and Documentation Center, WOTC, screening a movie and engaging directly with women and some men at the grassroots whose voices are often unheard. Each gathering started with a panel of discussants, followed by a town hall conversation. And at the center of the honest, open conversation is unsafe abortion. Statistics show that Lagos is facing a silent emergency. A new study by the Leadership Initiative for Youth Empowerment reveals that unsafe abortions account for 37% of all pregnancy-related deaths among women in the slum areas of Oshodi, Isolo, and Mushin. These are not just numbers, they are women navigating poverty, stigma, cultural pressure, and a health system that continually fails them. The study also found that 37% of respondents had undergone an abortion, many in unsafe conditions. Financial pressure, partner rejection, fear of stigma were the main reasons. 86% of these women earn below the national minimum wage, and safe healthcare is out of their reach. Now, the documentary revealed painful realities. Women turn to unsafe abortions because of rape, incest, and life-threatening medical complications. These women are therefore at the local governments asking the federal government to amend the abortion law, because criminalizing abortion is not preventing it. It's even making it more deadly, and people find a way around the law. Around the world, countries are recognizing that restrictive laws do not stop abortions. They increase unsafe procedures. So reproductive rights advocate Dr. Lena Wen says the question isn't whether women will get abortions. The question is whether they will survive them. And so from Latin America's recent reforms to ongoing debates across Africa, the global trend is shifting towards protecting women's health rather than endangering it. So here in Nigeria, the proposed Criminal Code Amendment Bill 2025 seeks to criminalize the supply of abortion-related drugs with a 10-year jail term, forgetting that the VAP Act, Section 38, requires that survivors of sexual violence receive comprehensive medical and psychosocial support, including emergency treatment that protects their health and dignity. That legislation will deepen the crisis. So I ask for clarity, compassion, and courage, because Nigeria needs to really rethink her abortion law.
I think this is the first time on a place at the table that we're having this conversation. Mm-hmm. And that tells you how difficult it is, because it's something that I think abortion a lot of people would rather just avoid having that conversation about it. Now, in Nigeria, abortion is illegal. Okay? Whether you're looking at it from the criminal code or the penal code,
everywhere.
It's illegal in Nigeria. Yeah. And the only exception is if the life of the mother is threatened.
Or the life of the
and that itself is not very specific. It's very vague in that fact. So essentially what it means is that in any medical facility, public medical facility, you can get reproductive health services like this. Yeah. And that's why, your advocacy looking at the laws, we must look at the revision of the laws to see what are the exceptions that we can give, and to be a lot more, reasonable with it. Our laws doesn't make exceptions for incest. Yeah. It doesn't make exceptions for rape. Yeah. It doesn't even make exceptions for the advancement of technology right now, to the extent that in the womb, you can know the state of a child before the child comes in.
Thank you.
And then it brings up the question of choice.
Yes.
It doesn't even say, okay, is this 6 weeks or what? It doesn't say anything. So I am for the revision of the laws to look at this. I won't go as far as, really, I still want to stay somewhere in the middle somewhere, but I acknowledge your courage in starting this conversation.
As of last month, we were going to hit 9 million beds this year.
In Nigeria?
Yep, this year. That's the total population of Israel.
9 million birds. In 2025. Okay.
Yep.
So we have 9 million children that are below.
By the end of this year, we might hit that figure.
Wow. Now they're born now.
So whoever is listening to us now, please just put that somewhere. 2, we cannot develop economically. I repeat, borrow 1 billion
every market day.
The mouths that will swallow the money
are waiting.
Yeah, and we are not producing. So you know that
We're producing children,
that population is an advantage when it is a pool of talent. Now we have a population that is
draining.
Our capacity is not so strong. So the more we born, pardon our French, the more we born enter trouble. And I'm going to drop on this. China is a world power today. What we don't know about China is abortion policies helped China to manage its population.
So I want to pick from what Kingsley has said to also say that this is a very important and sensitive conversation because it's almost swept under the same area when you start talking about family planning. And it's almost like family planning can never be given the right attention because the people that are supposed to, again, legislate this laws are people that have multiple wives and want multiple children, right? So it's a conversation that we need to have. And I want to highlight very quickly just this part of your advocacy where you talked about the proposed criminal code and then also having VAP Act. And that talks about how, I think we've talked about it on the table where there is no interconnection and relations among the laws and the
policies.
What do they call them? MDAs. They are not communicating with each other.
Collaborating.
There's no collaboration. So I know there's no time, so I'm going to leave it at that. The family planning conversation is something we need to bring back to the table.
37% is a lot. It is. 37% is too much. It's heading to almost 50%. It's too much.
Qualified.
Definitely.
37%.
Just to round up, revisit the abortion laws. Definitely, please, because there must be extenuating circumstances that will help them, widen, whatever policies that have to do. Because criminalizing it will mean that people will find more hazardous and harmful ways to get around it. And then you lose both mother and child in the process. So let's put humanity before it. As you can see, we have used every inch of our time intentionally and unapologetically.
This word.
What about you? You keep the conversation going till we meet again at the table, same time next week. For now.